Lara and I'm a registered nurse and I've worked across the NHS in Greater Manchester for the past 12 years. We're on a mission to keep improving all of our health services and get patients the help that they need at the right place and at the right time. But we need your help too.
Across Greater Manchester, we have 10 NHS trusts for a population of 2.8 million people. When we are very busy, hospitals don't run as smoothly. A&E departments can get very busy, meaning waiting times can be long as we need to make sure those who need our help the most are seen first. Sometimes ambulances have to wait with new patients and that means they can't leave to respond to other 999 calls. Together, we need to find ways to reduce hospital pressures to make sure those who need help get it. If you can get to know where to go for non-emergency conditions in your local area that offer advice and support for many physical and mental health conditions, it helps reduce hospital pressures, gets you treated much faster by the right people, and can help you to be back home more quickly.
So, when is it time to go to A&E? A&E is for emergencies only.
These include serious or life-threatening conditions such as road traffic accidents, serious falls, chest pains, breathing difficulties, and bleeding that won't stop. If you're unsure whether to go to A&E, make sure you contact NHS 111. You can either visit 111.nhs.uk or call 111. For instance, if you have an urgent but non-life-threatening medical need, such as eye problems, toothache, sprains and strains, cuts and grazes, a high temperature, or ear and throat infections, they can tell you where to go. And in some cases, book your time slot so there's less waiting when you get there. For instance, you could visit us at one of our urgent treatment centres or walk-in centres. And you may not realise how much help you can get at some GP practices from a number of professionals, including physiotherapists, health and wellbeing coaches, pharmacists, practice nurses, dietitians, and mental health professionals. And don't forget, your local pharmacist is a highly trained medical expert. They can provide you with advice on various conditions and provide prescription medicines for some conditions without you having to make a GP appointment. Details of all these services are available to view on the GM Integrated Care Partnership website.
Now, if you are admitted to hospital, there are a few things that you can do to help relieve pressure and keep things flowing.
During our busiest times, we can have around 800 people in our Greater Manchester hospitals who are well enough to return home or to another place of care more suitable. Our priority is to help you leave hospital on time and with the right support in place. It's our job to help you get to know where to go for follow-up treatment and aftercare at home. Whether that's treatments at your local GP practice, hospital day clinics, or through home care services. We also have hospital at home for those who need continued care at the place you call home via remote monitoring. When you're ready to go home, make sure you arrange to be collected on time by your loved ones or carers as soon as you're discharged. It will also help open up beds for our new patients.
All these things can help you recover well and reduce your chances of being readmitted into hospital.
After all, there's no place like home. Your actions can make all the difference to people who need our care.
Together, we can keep our hospitals and medical services running smoothly. Help us to help you. Get to know where to go.
For more information on healthcare in Greater Manchester, visit the GM Integrated Care Partnership website at gmintegratedcare.org.uk.